Everybody knows about migraine. If they don't already suffer with it, they most likely know somebody who does. And many people know of tension type headaches, and they might actually know about medication overuse headache and perhaps even chronic daily headaches. And some at least have a vague idea of cluster headaches and paroxysmal hemicrania. Okay, maybe not the last one, but you get the drift. There are many headaches that are known out there in the ether. But underneath this tip of reputable disorders lies a huge iceberg of rare, cryptic, and enigmatic headaches that every now and then emerge to perplex the victim and to challenge the wits of the neurologist. So, for the patient that occasionally walks into the neurology clinic with a truly esoteric headache, let's count down the 10 strange headache disorders you need to know about. Number 1 is airplane or aeroplane headache. Frequent flyers collecting their cherished air miles probably need to know about this the most. This is because this aeronautical headache is very unusual to afflict novice flyers. Airplane headache may develop anytime during the flight, but it prefers to emerge at the end of the flight when the plane is descending or landing. And the cause is thought to be changes in the cabin pressure leading to drying up of the airway passages. Don't ask how that leads to airplane headache. It just does. Luckily for its victims, the headache usually resolves after disembarking, but it may persist in some cases and recur in others. What can you do to prevent it? Try some naproxen or nasal decongestant spray before flying. Number 2 is bathing headache. This is a headache that comes on suddenly upon contact with water, especially if the water is warm. It may feel like a migraine because it may be accompanied by nausea, vomiting, as well as by sensitivity to light and noise. But don't worry, the solution is not to avoid taking a bath and not even to bathe in freezing cold water. Something called nimodipine can rescue the situation. So, the bath addicted out there should fear not. They can still keep the backs of their ears clean while splashing in their jacuzzi. Number 3, brain freeze headache. This is more popularly known as ice cream headache, but a more accurate name for it is cold stimulus headache. This is because it can be triggered by any cold food or drink, not just ice cream. And the contact zone doesn't have to be the mouth. It can be triggered by cold stimulation of the head. Other triggers therefore include diving, surfing, skating, and bathing in cold water. And you cold water bathers thought you were safe. And by the way, it can also be caused by inhaling the cold substance. What can you do to prevent it? Well, you can choose different parents, as it tends to run in families. Okay, seriously, consume that vanilla ice cream slowly. This reduces the chances of developing the headache. Number 4, yawning headache. This is a severe and recurrent headache that is caused by yawning, obviously, but also by belching, less obviously. Yawning headache tends to localize itself over the head, the upper neck, and the upper airway. It may be primary without any underlying cause, or it may decide to accompany such disorders as trigeminal neuralgia, in which case it is called secondary. We now come to number 5, hypnic headache. This is a headache that occurs exclusively in sleep, and most of its sufferers are over the age of 50 years. Hypnic headache strikes at a predictable time during sleep, and it awakens its victim with a generalized headache. You can resolve it by getting out of bed and performing any activity. Or you can prevent it by taking a pre-bedtime cup of coffee. I know, paradoxical, isn't it? Anyway, I know which option I would choose. Number 6, sunrise headache. This is a headache that develops on waking up after sunrise, and it is related to the deficiency of the hormone melatonin. And the cause of this deficiency is often lesions interfering with the function of the pineal gland, a structure in the brain that regulates the production of melatonin. I'm not sure that waking up before dawn will sort this one out, but that's not a bad habit. But popping some melatonin can treat it. Number 7 is neck-tongue syndrome. Imagine having a headache every time you turn your neck. Worse still, imagine half of your tongue tingling or going weak at the same time. Well, some people don't have to imagine it. They live the aptly named neck-tongue syndrome. And the culprit? This may be arthritis or dislocation of the upper neck joint called the atlantoaxial joint. The atlas and the axis are the nicknames of the upper two neck or cervical vertebrae. So have that neck checked out. Number 8 is linear headache. I guess headaches don't come any simpler than being in a straight line. Yes, linear headache is a headache that occurs in a line that is 5 to 10 millimeters wide. Yes, neurologists have measured it, and occurring only on one side of the head. The line begins from the back of the head, called the occiput, and travels all the way to the forehead. And it can be provoked by noise, bright light, menses, fatigue, and depression. If it persists, an aliquot of Botox might just do the trick. And number 9 is nummular headache. If it can happen as a straight line, why can't it happen as a circle? And this is exactly what nummular headache is. A headache that occupies a round, oval, or elliptical area that is 1 to 6 centimeters in size. Yes, we like our tape measures in neurology. For some reason, most people with nummular headache have an underlying autoimmune disorder driving it. It is not heartening that it can occur in multiple areas around the head. It does. And it is not encouraging that it may lead to hair loss. It does. But it is reassuring that the pain does not radiate to other areas. It stays exactly where it is. And it is also comforting that the size doesn't change with time. And we come to number 10, epicrania fugax. This is a brief pain that is located over the back of the head. And I mean brief. It lasts just 1 to 2 seconds, thus the name fugax, which means transient. Although it may start spontaneously, it may also be triggered by touch. Characteristically, epicrania fugax tends to radiate towards the eye, the nose, and the forehead. And it may do so in a straight line, or, curiously, it may take a zigzag path to its destination. Epicrania fugax may also be accompanied by tearing, reddening of the eyes, and running of the nose. This makes it a mimic of cluster headache and the other so-called trigeminal autonomic cephalalgias that do the same. And it is not surprising that it can evoke anxiety, panic attacks, and depression in its victims. So do you think you really have an unusual headache? Thank you for listening or watching this podcast. If you enjoyed it, why not click on the like button? And better for me, subscribe either to the YouTube, Apple, or Spotify channels. And whilst waiting for the next episode of the podcast, you might want to check my website called Neuro Checklist, or better for me, get my book called Surfing the Brain. Thank you very much for your time.